So strength training and lifting weights is known to be good, right? But a lot of people are fearful of getting injured, right? Or that they may feel that they can't lift weights because of like back pain or some type of knee injury or something like that. What's the best approach for those individuals? What would you say?
The answer is really dependent on, are you going to enlist the help of a professional or not? And a lot of people are determined to do it on their own, and that's completely fine. But you want to be aware of the risks associated with that, because there might be some components of movement that you don't know that are baseline criteria in order to express certain movement. For example, if we look at a squat, you may have previous lower back pain, but your back no longer bothers you. It doesn't necessarily mean that the problem is resolved. As a result, it's just your body may have adapted. That's why you don't really feel any pain or discomfort anymore. It's
Hmm.
compensated to allow you to just keep functioning, and it no longer hurts. What you might not be aware of is the reason for that back pain in the first place is that we were lacking internal rotation at the hips. There wasn't enough mobility at the hip joint. And sometimes when you don't have enough mobility at the hip joint, that will lead to your low back or other structures like your knees having to take on more force. So you may be a person that wants to resume squatting, but again, in the example that I said, it doesn't hurt you, and that's fine, but you still want to proceed with caution, especially if you've had a previous injury or you currently have an injury. Rule of thumb is you don't really want to go past the point of pain. Partial reps, ranges of motion are great, but then you may hit a plateau where, because of these injuries, you can't really proceed any further. There are many great cases where, resistance training, low grade in terms of risk, they can help improve these injuries. And then that's really great for you. But it would be helpful if you have a better understanding of what exercises to avoid and what exercises are really going to be best for you. So especially if you're injured, especially if there are old injuries that you are concerned about coming back, it would just save you a lot of frustration and potential more harmful injuries that can have you sidelined indefinitely
Right.
by enlisting the help of a professional, because we can explain, this is why this pain has occurred in the first place. We need range of motion here. If you're wanting to improve this, then we need to address A, B, and C.
Right.
Whereas if you didn't have that help of a professional, you might be doing 1, 2, 3 when it should have been A, B, C.
Right. Right. Right.
Yeah.
Right. Right.